Another type of hip slide is hip slide collapse, which is very common, can be diagnosed early. This is a normal variation of occlusion, but can be diagnosed early. Multiple teeth will be bone. In this case, I will show you multiple teeth will be bone. Like this is bone, there is no tip here. This is bone. This is upper one tooth is bone. I will show you the lower one. These are bone. Okay, these are bone. There is no tip here. Now this is bone. Some teeth will be broken. Okay, because some teeth will break. These are bone. You can see these are bone. You can see the portion. Young age, you will start seeing that some teeth are bone. The classical case. Then you will see less tooth visible. Front side, the lower tooth will be less visible. Mostly the teeth are this much visible on the front side. So this is an early indication that the jaw is in hip slide collapse. Then the front, when it collapses further, the upper teeth open up. So they are opening up because there is no place for it to go. It pushes them. So the front teeth openings open up. The spaces develop in the front upper teeth. This is a classical sign of hip slide collapse. So multiple small chips, but sometimes some teeth broken. So carefully, if you take a 3D scan at early age, it will detect the hip slide collapse. So if it is detected early, what we can do is we can just correct the occlusion, and this is the way we bring it, and but we have to restore them. This is going to restorative alignment. Simple alignment will not stop because we have to build the canine tips. Otherwise, it will go further inside. So now you can see from inside the edges of the lower teeth will touch the upper palate. This is a classical sign of hip slide collapse. So it is collapsing and going inside. Normal occlusion is this much. You see the lower front tooth. But in this case, the hip slide collapse is beginning from here. It begins from here only. It begins from here, goes slightly more. Then one tooth goes off. Then one tooth wears. Then the slide increases. The collapse increases. Then it keeps on traveling this much. So this is hip slide collapse. Collapse means it is going inside. But when it touches the upper palate, there is no place, it pushes the front teeth. So this is a classic hip slide collapse. One type of hip slide occlusion is hip slide wear. It wears in front, come in front. Second is hip slide collapse. It wears but goes inside. Then third is hip slide push. Hip slide wears and pushes the front teeth. And sometimes hip slide tilt or a combination of anything it can be. But this is a classical hip slide collapse where some teeth are broken. This tooth is touching the palate. Canine tip missing on one side, and if you see this canine tip, you will realize that one side tip is okay and one side tip is gone. One side tip is this is almost gone, and other side tip might be okay, or sometimes this also goes. This is still slightly there. So one side goes and then it goes on. Once the anterior teeth collapses, the posterior will break soon. So it can be stopped as early as possible. We need a correction of deep bite plus restorative alignment. You cannot simply just put aligner or braces. You have to align them, correct the deep bite, but you have to do restorative alignment. Means there is a difference between alignment and restorative alignment. So this will go into restorative alignment because some teeth are already broken, canine tips gone. So simple alignment cannot restore this back to normal. Restore this back to normal, it will come back again because it's imbalance. So you have to do restorative alignment, not alignment. Go back to the section and see what is restorative alignment and what is alignment.